with PES statements in just 3 steps. Hi everyone, welcome back to my channel. My name is Deba, I'm a registered dietitian, and on this channel I share tips and tricks with how to complete all of the components that you need to do in your dietetics degree, but it can also be helpful to other undergrad students as well. So let's jump into it. This is our case study. It's purely made up, completely made up. We have a 52-year-old male admitted with PTB. He's RVD reactive and he was non-compliant with treatment. We got the diet history, anthro, clinical, biochem. He wasn't eating well, history of not eating well or low oral intake, weight history and current weight was also given, and the muscle and fat stores below the 5th centile, which really indicates wasting. Then we got the vitals for the clinical signs, and we got diarrhea and poor skin turgor because of him being dehydrated, and the blood. So deranged electrolytes, high sodium, CRP was high, and the white blood cells were high, and the albumin was low. I've also just indicated meds as well. Step 1 is going to be mark, right? You take 4 different highlighters with you to the exam room. Okay, it's going to make your life so much easier. You take it with you to the exam room. So you allocate a different color for a different sign. So for example, I've allocated green for the diet intake, right? The low oral intake past 14 days, not eating well in hospital. Yellow for the anthro, blue for biochem, blue for clinical, and then pink for biochem. It makes your life so much easier with organizing the information, just picking it up immediately. Okay, especially if you are really under a lot of pressure and time constraints, especially in an exam. Just think. So once we've highlighted all of the areas, right, then we are going to think about the pathophysiology of what has caused the signs and symptoms, and also in relation to the disease condition specifically, and all of our nutritional problems related to the signs and symptoms. And from that, we will then be able to make our PES. Okay, so now that everything has been separated into A, B, C, D with highlighters in different colors, makes it easier for us to write down our problems and pathophysiologies for each one. I'm not going to go through each one of them, like every problem, but the most remarkable ones, right? For diet, we have the most common, or the one that comes to mind, is inadequate oral intake. The pathophysiology for this one, I would say, would be the inflammation. It normally causes anorexia in patients. And also, we could also say or think about an alternative feeding route that might be needed, either an NGT or something like that there that we could be thinking about. But first port of call is trying to get in something orally, right? If we take in the oral intake with the anthro and biochem, looking at the electrolytes, this patient is at risk for refeeding. That's why I've also indicated it there. Then for anthro, we look at all of this. So the loss of muscle stores, fat stores, the weight loss history, right? Definitely speaks to malnutrition, unintentional weight loss. I've indicated the pathophysiology as inflammation, hypocatabolism, and specifically inadequate oral intake. So we can use this interchangeably. There are some statements that we can use interchangeably in terms of the problem as well as the etiology. So you can say inadequate oral intake related to inflammation is evidenced by low intake in the past 14 days. Or you can say unintentional weight loss related to inadequate oral intake as evidenced by the anthro and the diet. Okay, I've also just included the at risk for refeeding. Looking at the vitals, we have a few. So again, the oral intake is there, increased energy requirements, which speaks to the hypometabolism, right, related to hypometabolism. And then relate with regards to the diarrhea, definitely increased fluid requirements, right? There's an altered gut function, right? Possibly due to HIV-associated enteropathy. Things like that you can include. So any problem that comes to mind related to your signs that you have seen in your case study, you jot that down on the side of the page or near it or something like that, just to help you think through all of the best statements that you would want to include. The same goes for the biochem. Especially in this patient, I would say micronutrient requirements is important for immune function, things like vitamin C, zinc, selenium, etc., as well as the refeeding comes up as well. Okay, now you're ready to go to your best statement table and put in all of this information. At the point, if you do have time in your exam, say you have 15 minutes for your best statements, you can also just do a quick quadrant table thing like this, where you have your A, B, C, D, put all of your signs and symptoms specifically. With the dehydration, yes, it can be a related to statement or an etiology, but also just to indicate the specific, yeah, it's clinical. So the specific signs, the poor skin durga, diarrhea for however many days, whatever it is, the specifics of it. So the measurement things, the observations indicated in this. This is going to also make your life easy for you, but this is only if you have time. If you don't have time, don't do this. The highlighting should work. Write our best statements down in the table. Statements is like putting together a puzzle, right? I've indicated all my different problems related to all the etiologies as evidenced by the signs and symptoms. Now, this is just a few that I've gotten from the case study, but you can come up with much more different ones, things like that. Problems and etiologies can sometimes be interchangeable, okay? It's basically what makes sense for you, and also it needs to make sense. That's the thing, right? So for example, the first problem I've noted is patient is at risk for refeeding syndrome related to inadequate oral intake, okay? As evidenced by, you can put the anthro, biochem, diet, things like that there. The second is inadequate oral intake. You see the interchangeability of it. But also, remember, your examiners don't want you to use the same problems and etiologies for everything. We can't just say, for example, malnutrition related to HIV, as evidenced by whatever, increased protein and energy requirements related to HIV, because that's the same etiology. Okay, we don't want to use the same thing for each one. So that's why I've done a few. You can come up with many others, okay, but this is just basically for context. Okay, if we look at the malnutrition, so I said malnutrition because it's quite remarkable in this case, related to possible HIV associated wasting. I put a question mark next to that. Okay, you could write that. You could also say inadequate oral intake. You could say the hypermetabolism and catabolism due to the inflammation, right? And then your signs and symptoms, your ABCD. The same thing for increased protein and energy requirements related to the hypercatabolism metabolism. I've grouped protein and energy together. You can separate them if you want to, just make sure of the etiologies, things like that. You can't repeat that in an exam or test because, yeah, you will not get all of the marks. So, and then indicate all of your signs and symptoms. Same thing with the micronutrient requirements, okay, as well as the increased fluid requirements. So with the fluid requirements, I said possible gut dysfunction, okay, possible HIV enteropathy because the gut is not absorbing all of the nutrients or the water and things like that because of the flattening of the villi. So that's why we have diarrhea. And also, yeah, I've also put a dash or slash dehydration, the signs and symptoms in terms of having diarrhea for 14 days, or, the indicator there, the poor skin turgor, things like that. So it needs to make sense. That's the main point, okay? And also another point, don't repeat your etiology. You can't have the same etiology for 2 or 3 things. The examiners want you to use different etiologies for different problems. Okay, so the problems need to link to the goal. If you're going to say refeeding syndrome, you need to say, what are you going to do? Are you going to start feeding very quickly, very slowly? It needs to speak to your problem. For example, inadequate oral intake. The goal would be to provide a solution for that. So say smaller meals throughout the day, smaller snacks, whatever it is. For things like energy and protein, you're going to insert your requirement. Okay, so however many grams of protein per kilogram per day, however many kcals per kilogram per day of energy you're going to provide. Your short-term strategies and long-term strategies. Short-term, always in hospital. Okay, what feed are you going to give in terms of energy and protein? What are you going to give a micronutrient supplement? What are you going to do in hospital? Long term is always education. And then looking at your monitoring and evaluation. This always speaks to your signs and symptoms. Okay, so if you've seen, say, diarrhea, you're going to monitor that in hospital. If you've seen weight loss, you're going to monitor that in hospital in terms of taking weight every week or taking the MUAC every third day, whatever it is, you write it in this column. Okay, so these need to link problem to goal, signs and symptoms to your monitoring and evaluation. Your strategies speak to your goal. How are you going to achieve your goal specifically? Okay, this is just how I used to do it in my tests and exams. I hope this helps. Also, check out my first video on how to do an integration. It's definitely like a golden key to doing PES statements, right? But this video specifically speaks to how to do PES statements in tests and exams. Like, subscribe, share, and thank you so much for watching.